Hi, everyone. Thank you for joining. Hi, everyone. Thanks for joining. I am Rahul Mitra, HHIE CEO. I just wanted to welcome you all. I think we have a very big group. Thank you for joining, and thank you for responding to our information survey. I'm excited to see what our capable provider services team has to share, and then I think you'll hear a little bit from me and Dr. Burton afterwards about future direction. So with that, I'm excited for this hour, and I'll pass it to you, Clarissa.
Yeah, thanks, Rahul. We're excited to really bring forward some of the cool things that you guys brought to our attention in the survey, and whether it's a fix that we already have some workflow solutions for you, or it's stuff that's coming down in the future. We're really excited to bring that forward. And just to quickly introduce myself, my name's Clarissa. I am the Director of Provider Services, and I see a lot of familiar names in here, so you guys probably know me as well. But for those that don't, I am the lead CHR trainer, as well as our Notify tool. So I train all of our users on how to use the Community Health Record and Notify. And using my background as a clinical professional, right? I'm a family nurse practitioner. I have worked as an RN and also as an MA and pharmacy technician. So I get to bring all of that clinical space to you, our users, for real workflow solutions and easy navigation tools as you navigate the CHR. So I'm really excited today to kind of go over our findings and show you some real workflow things that we can bring to your attention now that can help in your pain points. And I'm going to turn it over to Jackie for her introduction.
Hey everybody, I'm Jackie. I am also a member of the provider services team. I am the client relations individual who does the RegPass portal. I help people troubleshoot when they have issues with their password and logging in, or if they find anything that's going wrong, I help them kind of work through that. I also have a clinical background as an SLP. I spent about 10 years in acute care and doing some work in SNFs, and I also was the admission director of a SNF. So really excited to get going and get into what we're going to work on today. So just briefly, just going to go over the agenda. First, we kind of went through who we are and why we're here. And then we're going to use a bulk of our time to kind of go over a lot of the questions, or the most commonly asked questions that were provided to us, stuff that we can address and give you actual real solution today. And we're going to do that via explanation and a couple demonstrations with the CHR and through screenshots and whatnot. When we're done with that, the pain points that we can't maybe address today, but we are planning on addressing it tomorrow, will be kind of discussed towards the end of the session. And after everything is all said and done, we will then have a Q&A session. If there's anything lingering that you want to ask, you can feel free to do that. That's it goes without saying, though, feel free to ask questions throughout, and you can either put them in the chat or in the Q&A section, and we'll get to them and try to answer them as we go. Starting off, we got a couple of questions about, can we have easier access and yearly training? Can we have more training? I know that there's more in here, but I just can't use the search tool appropriate. And we're here to tell you that every CHR subscription or Notify or whichever tool that you're using includes unlimited training. So if you're feeling like, I've been using this for a while, but I feel like there's more and I'm not getting or able to maximize the system, we're available in person or via webinar whenever you want. It doesn't have to be a one-stop shop. You had your initial training and that's it. If you reach back out to us at any time, we're happy to get you set up. Some people, and actually this has been happening a lot lately with our audit, some people will just reach out and say, hey, I need a refresher. It's been a while. I've been using it every day, but I feel like I forgot whatever you taught me, you know, a couple months ago. And Clarissa goes back in and she gets in. Another option too is, say you created a workflow or you remember something that you did during your training with Clarissa and you just want it presented in a visual way. We can also create a workflow guide or a document and give that to you via PDF so that you can save it and kind of pull it out whenever you want. Lastly, I did want to bring up If those options aren't available to you, a couple of you should already know this, and this is sent to every new user when we offer our training, is that we have a YouTube available. And our YouTube is screenshot. And I mean, it has timestamps. So if there is something specific that you are looking for and it's only that item that you want, you can just click on that. For example, if you want those DOD or Tripler records, you can click on that timestamp and it'll bring you exactly to the video, that point in the video where you can find that information. And this is, mirrored to be just like a real training would be if you had sat with Clarissa and gone through it right then and there. Another thing that we had heard too was people wanting 24-hour access, and that is something that is already available now. The only time that we may have issues if there's downtime or if there's any errors, and the way we communicate that is through these system alerts. When there's some functionality that maybe isn't doing what it's supposed to, we do our best to communicate that with you. So if you log in and you see that here, know that it's something that we're working on, and we do update them as soon as we have our fix in. We try to go in and kind of update that alert as well. If you log in and you're finding an error, like for example, last week, we had a print function error, and we got several people calling or messaging us, and it was our users usually that find these things that are going wrong, and they let us know, and then we can look into it. And if it's something that we can resolve right away, either with you, we'll do our best. But if not, then we can take it back to our team and our engineers and work on getting a fix in. And yeah, so I think that is good for the system alerts. And then the only thing I do caution is when you do hit this X button, if you just kind of see it and you don't really actually read it and open it, once you click X, it's gone forever. So do try to read it before you get rid of it. Now I'm going to pass it over to Clarissa. She's going to go over some of our most commonly asked data questions.
Yeah, so the survey was really cool to see your responses. And a few of the main topics that we saw were related to duplicate and fragmented patient records. So that either included multiple charts for the same patient, difficulty identifying the correct record that you want to go into. For instance, someone mentioned that searching by the patient's name led to multiple patient names. It could be more than 10, right? Or sometimes it's even more. And it's a good idea to include the date of birth when searching a patient so that you have more exact. And so I'm going to show you some real workflow solutions that's going to help you to navigate exactly that issue and some others. And then that labs, notes, and documents are scattered across the profiles. And we're going to address that too with the demonstration. Document discoverability and usability. This one really ties into, how to find what you're looking for. So a lot of you mentioned that it was hard to find discharge summaries, progress notes, labs, and imaging. Someone mentioned to include diagnostic lab records, not just clinical labs. And we will cover, both of those are in the system. Someone said encourage HPH to share data, and they do. So the fact that the documents are spread across from the results tab and the documents tab, so it's really going to be helpful during this demonstration to show you where to find those records, because HPH does share records with us. And that the PDFs are difficult to view, meaning that the navigation resets frequently. And this one actually was an issue. Jackie brought this to my attention and helped me here as well, is when you pull in that documents tab query, that if there's multiple pages worth of records, if you click into certain pages and you open a chart and you go back, it's going to take you back to page 1. So I'm going to show you how to combat that frequently common issue. And then need for better organization, filters, and full text search. So that one is actually a very common question we get, is how do I search more efficiently? And I'm definitely going to be here to show you that in real-time demonstration. Timeliness of data was also another point that a lot of people brought up, is that delays in uploaded discharge summaries, notes, labs, and medications. For our tool, the community health record, it is in near real time, meaning if you're not seeing it in our system, it's most likely because that data has not been published with that organization. If you're looking for a discharge summary and it's not there, then it could be that discharge summary hasn't been completed by the physician, and that's why that summary is not in the system. It also relates to where you're looking, right? If you're looking in the results tab for a discharge summary from Kaiser, it's not going to be in the results tab, it's going to be in the documents tab. And so you may miss it out because of that. We also see someone mentioned that the query related to the patient's recent medications can take a while, and they wish this could be automatic instead of manual. I'm here to say that that is a very common question, and I will show you how to kind of combat that, because that medication query can run in the background. So you can definitely navigate to other tabs while you're waiting for that medication query to run. The next one was participation gaps. And on the next slide, Jackie, do you care to, there we go. So on the next slide, we do provide you a data sharing partner list, and Jackie's going to cover that, where to find that at the end, but we kind of broke it down for you to see. So on the left-hand side shows all of our participating hospitals and the different facilities that are sharing data with us. We do have all of the acute care hospitals throughout the Hawaiian Islands sharing in some capacity. And I say that because we know that, Kuakini Medical Center right now, they're only sharing their encounter data, which includes like a face sheet, right? Details of when the patient was there, when they were discharged, and what they were seen for. But we're hoping to expand that. And then we also see that we have that connection with clinical labs and diagnostic labs. So both of those labs are going to publish in the community health record. This also includes labs directly from Hawaii Pacific Health, Castle Medical Center, and Queens. So even if it's done within that hospital system, you're going to see those as well. And then we do have some other care facilities. Jackie mentioned it earlier. We do have Tripler and VA records in our system. They are pulled in through the documents tab, so I'm going to show you how to do that. And those records, what's really cool about the DoD records, so those are our service members and their dependents, is it's not just Tripler. This is across all of the military treatment facilities that clinical data pulls in. So even if you've got a new service member or a new family member of a service member who's in the area, you can pull in their records across, whether they're new and they've only been seen at other treatment facilities in the US. It's still going to pull in those records, which is great. And then we also have reach with our federally qualified health centers. Right now, we only have Molokai Community Health Center sharing data, but we're going to talk about that for future advancements at the end of the conversation. And then we also have healthcare systems, which is our ambulatory medication query. And so this medication query, probably one of our most used features in our community health record, and it really highlights the different medications that your patients are getting prescribed and taking at an outpatient pharmacy. So that query can be ran once a day per patient, and it will show you the last 12 months fill history across different healthcare systems, whether it's, your big pharmacies like Long's and Walgreens, whether it's mail order like Express Scripts, whether they do get their meds filled at the VA or part of the DoD. Even if they get their medications filled at smaller pharmacies, you can see that, it's going to pull in. I've been partnering with Molokai Drugs, and she's been a great advocate for helping me to determine what shows up in that tool. And even their medications show up, as well as KTA, 5-minute pharmacy. The list could go on, so we won't continue on down that road. But it's a very robust pool of medications. And I think we're good to go to the next slide. And I think that's going to include my demo, right? Let's see.
Yes, it is.
Yes. All right. So Jackie's going to unscreen share, and I'm going to start screen sharing. And we're going to come into some of those workflow solutions that you guys asked for. So a few of the big ones, straight off the bat, was the patient search, right? If you come into this patient search field, you've got this little open text bar. And this text bar is where you can enter in your patient's name, medical record number, social security number, or their date of birth. I highly encourage name or date of birth to be your primary search features. If you search by medical record number, and you're searching for a medical record number, that's specific to your organization. The medical record number for a different facility is completely different than your medical record number for the patient. So that could really limit what data you pull in to the community health record. Social security numbers are not always provided by the patient, so usually that one can also limit your data. But when you do a patient search here, just like what our user said, by searching name only limits and can display way too many people for you to have to sort through. My favorite way to do this is the advanced search. The reason I love this search so much is because it allows you to do exactly what that user, that survey was mentioning, is you can do the and, right? We all know that it's 2 patient identifiers when you're pulling up records or doing any type of verification. So this allows you to do that. And I can encourage you to use last name, first name, and date of birth. Now, one of the things that's really common here is obviously the hyphens. We do have some okinas. And so that name can be very different depending on which facility inputted that patient's name. And so what I typically will recommend is one of the things you can do is if that hyphen is in the first name or that okina is in the first name, then you enter in the last name and the date of birth only. Or if that hyphen or okina is in the last name, go ahead and put in just the first name, the first 3 letters of the last name, and the date of birth. And that's really going to help to capture all of the different spelling variations that may be in the system. And this is one of the kind of tricky things that we kind of have deduced over time that helps you guys to search a little bit more efficiently. So this is just my test patient, so I'm not going to do the advanced search. I'm so bad. I just mentioned this yesterday that I don't even remember my test patient's date of birth. So we're just going to kind of go through here and do our little search. And I'm going to talk about a little bit about this exact pain point that most of our users have. For our test patient here, we see there's 2 profiles, right? There's 2 profiles that really encapsulate what we can see straight off the glance is that it's the same patient, right? The same name, same date of birth, the same gender. We see that there's the same. So why is there 2 charts instead of just 1? So this really speaks to how an EHR is very different from an HIE. So within an EHR, that's your hospital's or your facility's charting system. So you have one patient for that patient, right? You have one patient profile for that patient. And when that happens, you've got these demographic sets and that's your patient chart. But HIEs are not an EHR and we do not just create one profile. So basically what happens is when that data comes in from the original source, whatever that source may be, from let's say clinical labs, when we first received data related to this patient, we created a profile for that patient. And that includes name, date of birth, gender, social security number. It can include their phone number, address. I'm probably forgetting a couple, but it includes all of those things that make up a profile or demographics of your patient. And then we create that patient. It's now in our Rolodex of patients. And then as new data comes in from the various different facilities, we run that against the original profile of demographics and say, you know what, does this confidently make a match to this patient's demographics? And our system is a really robust system that makes sure that it has to meet 95% or greater in order for us to do that. And so when you see a profile that has a plus sign next to it, that means that whatever's within that plus sign was confidently matched to that patient profile, and we were able to merge those records together. When you see one that's off on its own, it looks like a duplicate, but for some reason, when this particular patient went to Dr. Madamba's office, the data could not confidently be matched to that original patient profile. And we're going to talk about some of the initiatives we're doing on the backside that's going to improve this. But for now, we're going to just kind of touch on how you can navigate it and see that. Now, a lot of our EHRs today have interoperability, right? You're able to pull in some outside records from different facilities, like our Epic Care Everywhere connection. So how is that different? Because in an EHR, if you have a patient profile and you go to pull in those external records from different facilities, if the demographic doesn't match what you have on file, you're not going to pull those records in because it can't confidently make a match for those external sources. HHIE, we'll still display it. We're still going to show you the different charts that could be available for your patient, the different data that could be available, but we're just not going to merge it unless we can confidently say it's the same patient. We do have the plus sign, which is used to help navigate which chart. So that was another one. Someone mentioned to how do I know which chart to go into, right? I'm looking straight off. I can look at this. The best way to do that is if you've got multiple charts, and this is a small example of how that happens, but if you have multiple charts that appear for the same patient, look for what you're looking for. So if you are looking for a discharge summary and your patient was recently admitted to Queens and you're looking for records related to that inpatient stay, well, I'm not going to click the chart that doesn't include Queens, right? I'm not going to click the Dr. Madamba's office. That's not the chart I want. I want to click into the chart that has the data for the facility that I'm looking for. So that is a way to do it. Now, if you're doing a deep dive, and this happens for some of our users where they're doing some pre-work, right? They're looking through everything that's available. Unfortunately, you're going to have to go into each separate instance because what's in one chart is going to be different than what's in another chart. So if you see that there's multiple, you're doing deep dives for everything that's available, you're still going to go into all of those instances. But if you're looking for something specific, if you know you're looking from labs from clinical labs, you're going to click that chart that includes a clinical lab naming or that type of thing. So you're going to click into there. So just to kind of come into a chart, I just clicked into the one that had merged data from clinical labs in Queens. We're just quickly going to touch on how to navigate the results tab. So those two tabs where data lives is going to be the results tab and the documents tab. And I've probably hosted about, I don't even have a number, but I've hosted a lot of refresher trainings over the past year. And one of the things that has really stood out in that is that people who've used our system for a very long time, they do not realize that the documents tab has a wealth of data that comes in through that tab. It's about how to get it in there. So for now, we're going to focus on the results tab. And one of the things was how do I find it, right? How do I get to what I'm looking for the quickest? So if you've done a training with me, you know that I go through these things. But when you come in to the results tab, you automatically see these little tabs. And there's labs, there's RAD, there's trans, which is transcription. Those are our medical record reports, the path, and then if it's available, there's going to be a little cardio tab. And you can easily see that they're all automatically checked and your list of different records displays below. Now, this is a test patient, so it's very limited, but there could be 10 to 15 pages worth of records here. And you're trying to figure out which one's the one you want. Now, it does default to the most recent being at the top. So if you're doing a hospital follow-up and you know your patient was at Queens or Castle or Hilo or Kona, it's going to be up here at the top because it's more recent. However, if you say, you know what, I don't want to see everything, you can deselect all and hit just the trans, right? I'm looking for a discharge summary. I'm not looking for anything else other than that. You can click just the trans box, which then only displays those transcription reports. And you can easily navigate by date of service, what type of note that is, and the facility where that patient received that care at. You easily can click into it, open the little PDF link, which this is only for Queens and Kona, that you have a PDF link. Everybody else just displays. Either way, it either opens up to your note or you see that little blue hyperlink. And now you have your document to view. For those of you that don't know, we do have the print ability available. You can print to export this and save it as a PDF so that you can put it into your EHR. You can also use it this way. So if you come in and all of these are checked and you say, I'm really just looking for a lab, right? There's a specific lab you're looking for. You can use the search text box to type in that keyword. Okay, here's my lab. I can easily open that lab up and see that result and then hit print to export. Both of those are easy navigation tools in the results tab that could quickly get you to what you need as quickly and efficiently as possible. One thing I noticed yesterday, and it was really cool, someone mentioned to me, they said, you know, can I narrow it? Because sometimes when you type in the word, let's say it's A1C, right? You're looking for hemoglobin A1C. Our data here can go back to as far along as that connection has been established. But you say, you know what, I only want to see records related to the last year. I don't need to see, you know, 2016's labs. I just want to see the last year's labs. You can come up here and do the all records and only limit your search to that window. So then if you do type in A1C and you've got it set to 1 year, you're only going to see A1C results for the past year. The next tab is the documents tab. And this one, like I said, so many trainings, just like our user said, encourage HPH to share those. Well, they already do. So the documents tab is one that we often have to teach. So the documents tab, usually when you come into it, you're going to see just like it does now where it says no records to display. And that's because we have to ask for them essentially. So for our facilities like Rehab Hospital the Pacific and Molokai Community Health Center, their data is automatically pushed to this area. So if you come in and you go to the documents tab and you do see some data there, it's most likely from Molokai Community Health Center or from Rehab Hospital Pacific. But for our partners like the HPH, Kaiser, Maui Health Systems, Kahuku, the VA, DOD, and I'm forgetting one. Oh, HHSC Kauai. If you're looking for data from their facilities, we've got to find them. So we hit this Find External Documents button. And I have it in a screenshot because it doesn't work in a test patient. Everybody can see that, right? Jackie, you can see the Documents tab query?
Yes.
Okay. So you're going to come in, hit Find External Documents. You're going to, it's going to take a little minute. I'm sorry, this one's the only one I promise you have to wait on. But you do have to wait for it to populate with your patient's demographics. You select the checkbox indicating, yes, this is the person I'm looking for. Hit Find Patient Documents. And then it will return with a query result of pulling in those external documents. And it automatically will check it. So all you have to do is load those selected documents. And now you have them quickly and easily to view. For our users, a couple of the pain points here that they're pain points of mine too, is that when we receive data, it's definitely our Kaiser, VA, and our HPH participants. They're not sharing the date of the visit. They're sharing the date of the query. And so as you can see, for all of these HPH records, they all pulled in with the date that I actually grabbed these records from there. And this becomes a point of frustration for a lot of our users. And this is kind of where I come in with some helpful tips. So the facilities are all grouped by facility. You're going to see all of the HPHs together, all of the Kaisers together, and all of the VAs together. So you're never going to see them kind of intermingled. And you also can use that kind of order. So for all of the HPHs, whether it's 1 page or whether it's 10 pages, when you see all of those HPHs, the first top piece is going to be the most recent. So for HPH and Kaiser, they all have this continuity of care document, which is a very high level document. It usually includes things like encounter history, allergies, last vital signs recorded, sometimes immunizations. It's always going to be that first document you see. And you can see it here. You can also see it down here with Kaiser, that it's the first document that appears for them. Once you get past that document, you start to get into visit-specific CCDs. These are called continuity of care documents. And these are visit-specific. So each one is a different encounter. And this is going to be the most recent encounter. And then as you get to the bottom of HPH, that's going to be the oldest encounter. And then if you get to the Kaisers, it's going to start all over again. Same thing. All of the Kaisers, newest to oldest, and then get to the VA. If you have someone going to Tripler or any of the other military treatment facilities, this was a recent upgrade. Our wonderful IT team was able to work with our engineers to fix this. Tripler now pulls in with the date of the service. So that's a really big win. And so you'll see those at the bottom usually, and they will have the date of the service and a type of note that it is. One of the things I teach is really looking for what you're looking for. What is your specific workflow? And this is just an example of one of the ones I've put together for users. Is this person, their job is to look for preventative care measures, right? So I put together a workflow guide that really helps that user if they're looking for certain types of screenings. What will they be listed under? Certain, this is preventative care. So looking at those mammograms, cervical cancer screenings, colonoscopies, that type of thing. So if they're looking for those, what would they be labeled under? So that's one of the things that I can do if you want to set up training with me, is help there. For today, really kind of focus on the naming. If it's an office visit CCD, then that's going to be outpatient providers like a primary care or a specialty visit. This is also if you have someone undergoing PT, OT, or speech, and it's happening through Kaiser or HBH, that's going to be included in an office visit. If that person's been to the emergency room, it's going to be labeled as an emergency CCD. And then if it's a outpatient, like if they've gone to get an MRI or a CT scan as an outpatient order, or they've been admitted and recently discharged from an HPH facility, those are going to be labeled under hospital encounter CCDs. And again, most recent is going to be at the top. So if you're doing a follow-up for an outpatient or an inpatient discharge, not only is it going to be labeled hospital encounter, but it's going to be right up here at the top because it just happened. And so it's a good way to kind of help navigate that section. One of the other pain points that someone brought up with this tab is, you know what, I'm on page 3, right? So multiple pages can often be pulled in. I'm on page 3 and I click into a note. If I open that note and it's not what I want, when I hit the return to documents button, which is what you see at the top, it takes me back to page 1 and I have to jump back to page 3 to get to what I needed, where I started, right? So one of the things that I've taught, and one of the helpful, is what Jackie brought to my attention, use the back button. So instead of using that return to documents button, if you hit back, it will take you back to page 3 or wherever you started, instead of going all the way back to page 1. So really helpful guide there. And then as well, just kind of highlighting our CCDs can be printed. So you can print, save as a PDF, same as our results tab documents. And then another helpful navigation is the table of contents. So one of the things that happens when you get a CCD document is they are large, right? They are, if it's a hospital discharge, that thing is like 10, sometimes 30 pages worth of clinical data. And your time is so precious. And I want to help you guys to get what you need out of that document. Use your table of contents. So those are headers throughout that document. So if your job is to look for that discharge summary and you're looking to see what's the plan, right? You've got a patient coming in for a hospital follow-up. What is the plan? What did they need that patient to do to be successful and stay out of that hospital? You see, there's a labeling, plan of treatment. Use Control F, type in plan of treatment, and you're going to get straight to that piece in the document where plan of treatment is mentioned, so that you can easily get to that section instead of having to scroll through 30 pages worth of documents just to get to what you need. Or if you're needing medications, Control F medications. It's very easy to navigate and to use that feature. And you can use that in all of our documents. It's available, not just the documents tab. So that's the documents tab. I know that's a lot. The last section I really want to highlight for you guys is going to be the medications tab. This one is an amazing tool. However, it is one that, someone mentioned that they have to refresh it every time. And when you're looking at a medication, yeah.
We did have a question on this one, so I did want to interject and just kind of keep this in mind. And the question was, what if you were looking for community or ambulatory medications prescribed and a person has multiple profiles? Does it matter which one you choose and then you go into the med query and run it?
It does. It actually really does matter. And so when you click into those profiles, let me see if I can't figure this out for you. Okay, so when I'm looking at the profiles, when I'm in a patient search field and I'm looking at the different profiles, The one that I like to choose when I'm running a medication query should be the most, and this happens most of the time when it is those names with okinas or hyphens or different spelling variations, is try to choose the one that has the most data, or at least the most complete, like naming, very consistent naming conventions. So even though I'm in a plus sign data here, like within this plus sign, all of this data is available for me to see. Whichever one of these profiles I select within that plus sign, that is what presents at the top as my search, right? So that's my demographic that any searches are being based off of, whether that's the documents tab, whether that's the medication query, it is running that medication query search off of that demographic. So try to choose the one that looks like the most consistent and most clear. So that way, that's more likely to return a result. And and unfortunately that happens, and that's my workaround. That's how I've kind of helped myself to pick which profile I go into, especially for the medication query. So when you run a medication query, you come into the medication tab, you click that query medication history button. Now, one of the things that someone mentioned is that it takes a minute to load, right? We've all been there. That circle, waiting, waiting, waiting. That tool actually runs in the background. So if you are in the community health record and you're looking for data and you know you need medications, come and do it first. Come and click that button and let it run, because you can navigate to the results tab. You can go to the documents tab. You do not have to sit and wait on that to happen. It will alert you at the top that it's complete. And then you can return back to that tab. And now your query will be grayed out, because again, no one can run it twice a day per patient. You can only run it once a day per patient. And then your query date will show here and show you that the last query that was ran was from this date and time. And then your meds will display. What's really cool about this is this, again, it's across the US. So not just here in Hawaii, these medications pool. This is a really great thing for our tourist population, where we can run a medication query to identify what meds that patient's on. We get the patient's medication and strength. We get the pharmacy where it was filled, the prescriber, and the date of the last fill, which does default to being at the top. When you open that chart, it includes details such as the quantity and the day supply. Now, no, it is not a complete directions of use. Unfortunately, that's not built into this system. And that was one of the things that someone brought up, or a couple people brought up, is they wish it included the directions. One of the things that obviously pretty self-explanatory, if you've got someone who's given a quantity of 30 and it says it's a 30-day supply, then that's definitely a once-a-day use. However, I'm not saying that that's the golden standard, but that is a way to do it. Another way that we can do something similar to that is once we run that profile, or once we run that query, we can actually print it. And I have an example. This is what happens when you hit that print button. This is a fillable MAR that if you were at the bedside of the patient, or if you're on the phone with the patient, you can easily ask them, are you still currently taking this medication? How do you take it? And when was the last date and time of your last dose? And this is really helpful to fill in some of those gaps. And it even has a place at the very bottom where you can enter in over the counters and herbals. So it's a really great resource to use to fill some of those gaps and to get confirmation of those medications. Any other questions, Jackie, or related to the med query?
I'm just kind of explaining to Courtney that when it comes to the med query and you're saying go and push the profile with the plus, when you click that plus and a bunch of facilities come down, it just means that all of those facilities will be pulled into that profile. So even if you wanted the Queen's records and you accidentally click on clinical labs, it's still going to pull those Queen's records in, as long as it's within that one single profile. The medication list is the medication list in real time? That's a question that we just had as well.
Yeah, the medication list is in real time. This is kind of what we're working on. So this medication query is actually populated from a vendor. And so it's been kind of like troubleshooting and kind of getting a better understanding of what powers that medication query. Our team is working really hard to kind of get a deeper understanding. I know Dr. Burton, our CMTO, is on the call, and I'd like her to kind of give some feedback on that question, because, you know, how quickly will those medications show up in the med query once they've been picked up?
So as soon as they're, so can you hear me?
Yep.
Oh, great. Okay. So as soon as that script is swiped in the pharmacy, that's when it shows up in our medication query. So the only issue is that there are some pharmacies that go ahead and swipe that label before it's picked up. And there's something called a good pharmacy practices. And really what they're supposed to do is wait for that person to come pick it up. And that's when they swipe it. And that's when it will go to either their insurance or, you know, and they'll find out what their copay is. But unfortunately, for example, like Queen's Punch Bowl, I don't know if they're still following this workflow or not, but they go ahead and swipe that label before it's picked up. And then if it sits on the counter for a couple of weeks and it's not picked up, then they go ahead and enter that it was not picked up. So there is that chance at that time that some of those pharmacies that don't follow the good pharmacy practices, you would think that maybe they picked it up and it has not been picked up, unfortunately. So we are working with the pharmacies to improve that workflow.
Thank you. Yeah, it's very helpful.
Mm-hmm.
I want to kind of be cognizant of time. I love that those were like a lot of the pain points that a lot of you brought up, and I hope that covered a lot of them. I think going forward, you know, kind of getting back to what's the future roadmap. So there's a lot of really cool things that our users would love to see in the platform, and I'm excited. We have Rahul, our CEO, and our CMTO, Dr. Burton, on the call, because I really want to pull up some of those things that our users would love to see. My favorite one was, you know what, if we could just have full access to health records from all health systems. And I think that that's the end goal of what we all want. But where are we going to get there, right? So one of the things, and I kind of want to take this into like a talk story session about kind of what those future enhancements look like and what our users want to see. The first one is improving the data quality. So one of our users said, you know, if you could improve the quality of the data coming in, standardize what comes in, and increase the elements going into the tool. And I'd like to turn it over to Rahul to talk about, you know, what our data quality initiative and what we're doing about that.
Sure. Clarissa, I'm happy to answer. And first, I want to say I thought you did a phenomenal job, both you and Jackie, and I know the community appreciates it. So thank you for crushing this. Secondly, I had asked whoever wanted to share their names, and really more than kind of for business reasons, it was just as a thank you and to understand kind of who it is that we're helping to serve. It's been a tough time in healthcare, I think, in the state and probably nationally. And we're so thankful to you all providing the patient care, and we're happy we can be of service. Clarissa, before I get into that question, I also want to ask you, there was a few questions that maybe didn't get answered. Do you want to try to answer those questions first before we get into the roadmap? Or I know kind of time is limited, so I'll leave it up to you.
Yeah, let me review them while we're kind of going through future enhancements and kind of pinpointing what we're doing future, and then I'll definitely address those as I've had a chance to review them. And then we should have about 10 minutes at the end to go over, 5-10 minutes. So I'll definitely review those.
Perfect. And I think the questions were wonderful and they came fast and furious. So we will also review the chat, and I see Clarissa and Jackie's email as well. So if we don't get to the questions, please know that we will respond to you. Data quality is extremely important, Clarissa. That's a great question. And we spend a lot of time kind of thinking about working to improve data quality. Some of the kind of data quality issues happen with the data that comes to us. So it's a challenge to try to kind of improve data quality. We are kind of working towards getting rural health funding from the state. We're in kind of very constant communication with the state. And one of the kind of focus areas is data quality initiatives and improvement. So we started data quality working with Hawaii Community Foundation over the kind of previous 6 months or year or so, reviewing all of our data feeds against the US CDI version 3 to try to understand kind of what data we're getting and where it could be improved. And then kind of through rural health funding, we are going to create a data quality work group and work through specific data quality issues, focusing on, I think, the highest level needs from the community and the state. So I think we're going to kind of start with demographic information and understand how as a community we can start to move and continue to move data quality forward. So I think that's a high level response, but very important kind of for us to have the best data quality possible. Rebecca, anything to add to that?
Sure. And we have started working on a lot of that. For example, Queens Hospital Systems, we were not receiving their ICD-10 codes, and then that, I believe, was fixed about 3 months ago. And we're now receiving those ICD-10 codes. Other data elements we're working on, and some, as Rahul mentioned, the demographics. As soon as we're working with HPH and Queens right now, and improving, making sure that they include race and, for example, sex. And once you improve that and ensure that those data elements are included, then you're going to have more merged records. So you'll see a difference on the front end for sure.
Love that. That really shows like the actionable piece, like how that the improvement in data quality, especially demographics, is going to improve that patient matching piece so that we decrease the duplicate, right? We don't have to figure out which chart to go into.
There was a really good question about data earlier, and it was, can users download particular longitudinal data points? For example, somebody that manages an HIV clinic, they appreciate looking at viral load results to gauge treatment effectiveness over time. So what do you have to say about maybe being able to track something across time when it comes to maybe a dashboard or just, I guess, data tracking in general? I feel like
Did you want me to take that or?
Yes, please.
Yeah, Rebecca, you can take that one for sure.
So when we are planning on an upgrade in the future, we're not quite sure the date right now, but when we upgrade to this new platform, it'll allow you to run reports on your own. You'll be able to see trends, and I think that's what you're addressing is you want to see trends. Okay, is hemoglobin A1C going down over time? I think that's sort of what you want addressed, and I think we'll have those sort of options available next year.
Awesome. Another one of the questions that came in is compiling the records. And Rebecca, I think you mentioned the upgrade to the platform, and that's really going to make a difference here, is compiling the records into one easy area, one tab. And can you speak to kind of what that platform, and Rahul too, for both of you, changing the platform to be a more integrative, upgraded system? What does that look like for us, and what's it going to look like for the users?
So the upgraded platform, I'm sorry, go ahead.
Oh, no, I was just going to say at a high level, we understand that kind of it's difficult having to click on different patients because of kind of merging roles. Some of that is protective and based on kind of community standards of ensuring that we don't mismatch patients. And that's kind of for the best quality of patient care. So when you kind of see those multiple records, that's not necessarily a bad thing. I would say kind of moving to the new platform and continuing to improve patient matching is kind of important, and it's something that we're focused on. We work with Health Catalyst interoperability, and we also work with Rhapsody, a separate MPI vendor. And so, yeah, it's definitely kind of on the radar, and it's something that we continually try to improve. And I will just kind of, as I pass it to Rebecca, to say, viewing your own medical records on HHIE are based on your own participants' policies and procedures. It's not a simple yes or no question. It's like if you work at Queens, Queens will have a policy and procedure about whether or not you can look at your own medical records. But Rebecca, I'll pass it to you to answer a question on patient matching.
Well, I think the question was the different tabs, and with the upgraded platform, It doesn't matter how the organizations are sharing data, and I won't get into the different types of data that how they share now, because there's like ADTs and there's HL7 CCDs, but the new platform, the capabilities are going to be improved, and they're going to be able to merge all the different kinds of records into one tab. It'll be much more user friendly and in fact more intuitive. So you probably will need a lot less training on the portal as well. I think you'll be very happy with the upgraded platform.
We all know too, though, with provider services, we're all clinicians. We all come from that healthcare background. So we always find little cheat ways to help you navigate. So we're always here, even with an upgraded platform. And I'm super excited to see it. And I'm super excited to get my hands in there and explore it. But one of the things that was mentioned, and I think this is across the board here on Oahu, is Kuakini. Right. And Alice, we hear you in this. We've done some outreach to see how important this would be to our users. So right now, Kuakini Medical Center is only sharing encounter data, which is ADTs. That's that face sheet section. So can you talk a little bit about, what we're hoping to advance with Kuakini?
I'll take that one first. And I think there were a lot of questions, whether it was on Maui or kind of different specific facilities like Waianae Coast. I think Jackie can share the chart of what data sources we have, and we're continuously working to kind of improve and increase the amount of data we get in the system. And so we know Waianae Coast is important, the folks on Maui as well. And with respect to Kuakini specifically, we're in regular discussions with them. I think I have a lunch meeting next week with the head of IT at Kuakini, and we're trying to think through how we can use rural health dollars to kind of onboard all of those Kuakini data feeds. I think one of the things that is helpful is to kind of share and show Kuakini that their data or their full data flowing through HHIE will benefit patient care and the kind of independent provider existence, workflow, or patient care. Not only kind of within the inpatient setting, but also kind of for independent ambulatory providers. So to the extent we can kind of communally share that message with Kuakini, which we're working so hard on, I think that will make it easier or more likely to get the data. I think there's also a question of behavioral health service notes, but Rebecca, I'm going to see if you have comments on either Kuakini or my general comment about increasing data in the system.
Sure, Kuakini. So we're going to be receiving a rural health transformation grant, and Rahul mentioned we're hoping to put money towards that because unfortunately interfaces are expensive, right? And so we're hoping to cover those costs. But if you if you happen to be a practice that's on one of the nearby islands or in a rural area on Oahu, please reach out to Clarissa or Jackie and let us know that that data is important to you, and then we can relay that over to the person that Rahul is going to be meeting with next week. That might be a great incentive for them. I saw that the Maui data that you would like. Maui data is rural. It's a rural area. And I do think we can cover those costs. So it looks like Maui Medical Clinic, I can reach out to them and see if they have interest in sharing data as well. Malami Keola, they are now on Epic. And we do have Epic data share partners. So I do think we would be able to cover those costs as well. So I can reach out to them and see if there's any interest.
I love that.
And I'm sorry, was there one more thing?
No, you're good. Oh, behavioral health notes, Rebecca.
Oh, okay. So behavioral health notes is interesting because there's a lot of hospitals that want to share the data, right? But they're in their system. They have not separated out behavioral health from psychoanalytical notes, which cannot be shared. So they're right now in the works trying to separate that out in their EHR so that they can just share those behavioral health notes. So I think you'll see a lot more in the future. Right now with Queens, and Clarissa notices too, you'll see someone when they go to the psychiatric ward, you'll only see a discharge note when maybe a hospitalist is seeing that. But right now you won't see the psychiatrist notes discharging them because of that reason.
And I love that you mentioned, the different facilities. So the advancement of a lot of people say, like, can you make connections regardless of the EHR? And that's exactly what's so unique about HHIE and HIEs in general, is that it doesn't rely on an expensive EHR like Epic to make that connection with us. We're in communications with facilities like, or EHRs like Athena and eClinicalWorks, and I'm sure there's others, Cerner, so that we can get their notes regardless of what type of data or what type of EHR they have.
And I would add, Clarissa, for almost all, if not all, the facilities that I saw named in the chat, we've had conversations or discussions over probably over a dozen years, right? It's not that we're not trying or working hard, and that we haven't thought of those organizations, but at the same time, it's super helpful to see your need to have that organizations or those organizations' data. So we're working hard to continually kind of improve the amount of data in our system. And then the other thing I wanted to say in closing is, I think Clarissa is very happy, and Jackie are very happy to continue training and retraining. And I think they mentioned it earlier. I think there were a lot of great questions, which we were able to maybe hit on only at a high level, just because of the volume. I'm kind of personally humbled that we have 200 people listening to this great provider services team. But please reach out to Clarissa and Jackie, and they're happy to kind of continue to answer your questions as well. And we appreciate each and every one of you. So with that, Clarissa, I'll pass it back to you.
Yeah, thanks. I do want to continue these conversations because I think it's really helpful. So we do host this community forum every second Wednesday of the month. So please come back and join us. We'll send out an invite as those come out. I really want to turn it over now in the last 5 minutes to answer any questions you guys have. I think I saw, did I see a hand raise? I thought I saw a hand raise, but maybe I didn't. You can feel free to enter it in the chat. And then I'll turn it over to Jackie to kind of go over the helpful resources as well. Oh, thank you, Deborah.
Let's see. I apologize. I keep trying to display the data sharing matrix, and I'm not having luck with it today, so I apologize. But I did want to highlight a couple of our favorite resources. Again, there's our YouTube page. Not only do we post all of the forum, we have our training module there, but we also do post all of these forums on our YouTube, and that is available. So you can go, if you missed one, you can't get there, you can always just rewatch it. It's usually uploaded by that Friday. And then we also post it on our LinkedIn as well. So if you follow along with that, our data share partner matrix, I've put it in the chat a couple of times, and everything in blue on that matrix is something that's available and in CHR. Oh, and then the last thing that I know, I did try to show, I'm not sure what's going on with my sharing. Let me try it one more time. Let me try it this way.
Just to kind of, while you're working on that, no, I can't see anything. The slide deck will be shared. We can share that. It will be on our YouTube. The recording for this will be on our YouTube. And you can also access that. And then at the end, there's going to be detailed information regarding mine and Jackie's contact info. So if you want to set up a training to go more in depth into your personal workflow or any refreshers, please reach out to us to do that. Slots are limited to HHIE dependent on your organization. So Deanna, to answer your questions, depending on which organization you fall under, some do have unlimited access, some have more limited numbers for how many licenses they have. If you need to know specifics related to your organization, please reach out to us. And then we do not see.
Here's our data flow matrix. Sorry about that. This is what I was talking about earlier, and everything that's in blue is available in CHR. So I like to always send it out as a link, and this is updated constantly. We just updated it last month. But I think the last thing I did want to touch on is sometimes we'll get calls from people and they're trying to call us. The easiest way to get a hold of us, if you're having an issue, is just send a ticket into the help desk. helpdesk@hawaiihie.org will get you through to us the fastest. Sorry, I'm just making sure I'm not missing any questions here. Yeah, so if you have any issues like that, go ahead and reach out to us. Or you have our information from today, you can always just email us directly. And most of the time I say that when I send out an email to somebody, if you have any issues, reach out to us. We'll do our best to help out. Here is our emails. I put it in the chat a couple of times, but just in case you guys want to jot that down, it's here for you. And I guess just to close out, we did want to say thank you for everybody for giving up your lunch hour and coming and joining us. It's always appreciated when we have people show up. We love to talk about CHR. We love to share, and we love to make it as something that you find value in. So anytime that you want to have a talk story session, or you want training, please, please, please reach out. This is what we love. So I'll turn it back to Clarissa if there's any last final things we need to talk about.
No, I love that. The questions and kind of things kind of still reviewing over here. We had so much feedback and I love it. So I think Marcella had a question.
Sorry, I was trying to click the happy face.
Oh, okay. No worries. All right. Well, thank you guys so much for your time today. Like Jackie said, Rahul, any last comments before we sign off and give everybody back actually, we're right at the top of the hour.
Nope, just thank you very much. Have a wonderful day.
Right. Thank you all.
Aloha.
Take care. Thank you so much.
Marcella.